Okay, Selena, we're ready for you to just give the instructions in Mandarin.
OK， 大家好，非常感谢大家来听我们这次的课。如果是你是选要有中文翻译的话呢，我是 Selina，我是你们今天晚上的翻译，我会帮你们同传。请在你们的屏幕下面是看有一个地球的符号，你可以选择 Chinese 中文，有一个小地球的符号在屏幕的下面。选了中文之后呢，你会进入另外一个频道，你可以听到我的翻译。谢谢。
Thank you so much, Selena. So welcome, everybody. My name is Anna Pern. I'm the co-founder of the Chinatown Disability Advocacy Project, and I'm very pleased to co-host this workshop with the Philadelphia Department of Public Health COVID-19 Containment Unit. I'm going to turn it over to Betty, the COVID Containment Unit Outreach Specialist, to introduce today's presenters.
Hi, everyone. My name is Betty Magetta. I'm an outreach specialist with the Department of Public Health's COVID-19 Containment Division. I'd like to introduce tonight's speakers, starting with the clinical team, Mia Renwick and Pearl English. And we also have our schools team here. That's our pediatric partnerships team, Diana Coleman and Nina Grosberg.
Fantastic. Thank you so much, Betty. So today we're going to have two different subjects, one which is about COVID-19 specifically and how it presents and affects children. So we're going to have the clinical team from the Philadelphia Department of Public Health share some valuable information. And then we also have the schools team that can provide information that parents may have about, what should I do if my student seems to have COVID symptoms? Where can I get them tested, and so on. So I wanted to turn it over to our public health presenters today to share their screen and begin the presentation.
Pearl and I will go first. I'll share the screen. Pearl.
Yes, Mia, go ahead. Okay. Should I start now?
Yes, I'll put it in slideshow mode so it can be bigger. Or presentation mode. Yes, it's circling. Thinking about it, I should have let you share your slides. You got this snazzy new computer, Pearl.
Yeah, but I don't know how to work it. I need to learn. I just got it like an hour ago.
All right, here we go.
All right. So good evening, everyone. My name is Pearl English, and Mia Renwick is my colleague, and we both going to do this. Next slide. Next slide, Mia. Okay. Mm-hmm. So topics to be discussed today. Today we are going to do an introduction on what is COVID-19 and why it is dangerous, how to stop the spread of this dangerous virus, how COVID-19 vaccines work, the different variants of COVID-19, and the myths and the facts. So COVID-19 is a virus. It is spread through talking, coughing, or sneezing. It's a disease that is caused by the coronavirus, I'd like to say, And the symptoms can start between 2 to 14 days after catching this virus. You can get a cough, fever, chills, difficulty breathing, vomiting, diarrhea, body aches, loss of taste or smell. Sometimes you may get 1, 2, or sometimes, more than 2 signs of this illness. So even young people can get very sick. In the beginning, the older people and people with medical condition, underlying medical condition, became very ill and we lost a lot of people. But today, the young people can get very sick and there is a rise in hospitalization of young children and younger people. Next slide. So some of the signs and symptoms are seen here: cough, shortness of breath, difficulty breathing, fever, muscle, body aches, vomiting or diarrhea. Next slide. How to stop COVID-19. So some of the mitigating facts, some of the facts that can help us to stop COVID-19 is for us to do everyday things like washing our hands and using hand sanitizer where there is no running water. Avoiding close contact with people, with your friends, with students at school. That means staying at least 6 feet apart. Wearing your mask when you're in public, especially if you're indoors, like in close spaces, we encourage you to wear your mask. Cover your coughs and sneezes. You can sneeze in your elbow instead of sneezing in the public spaces. Clean and disinfect your surfaces frequently, like especially restaurants, children at school. We encourage them to clean their surfaces frequently. And if you're sick, stay home. Like the children, if they're sick, they should stay home. They should not go to school. And most importantly, get vaccinated. And we'll talk some more about the vaccine. Next slide. So this is some statistics. In the United States, COVID-19 deaths. For some reason, I can't see my left side of the screen, Mia. Sorry.
So the total deaths, the total cases, so on the left side of the screen shows the total number of cases. This is US data. So this is across the United States. So this is data issued by or collected by the CDC. The total amount of cases is over 42 million cases. Can you see the right
Yes,
hand side?
I could see it now.
Okay.
Yes.
So that number is over 42 million.
42 million. 7-day case rate in the US is over 100,000. And the total deaths in the US is 670,738 people. And this was as of September the 20th, so earlier this month. Next slide. So this slide shows our vaccination rates in the US. And so far, the total of number of people who got at least one shot, one vaccine, is over 214 million. That's 64.5% of the population. In the population 12 years of age and older, we have 213 million, over 213 million people vaccinated with at least one dose. And in the second column, the fully vaccinated population, we have over 184 million. And when we say fully vaccinated, we mean people who has had 2 shots, 2 vaccines for over 2 weeks. and that's over 55% of the population. Next slide, Mia. I won't go into all the minor details. So Mia, do you want to do this slide? Can you do this slide for me, please?
Sure. So this slide, let me share my video. So this slide shows the number of, still talking about vaccine in this slide. So we're showing the number of total amount of doses administered right here in the city of Philadelphia. So this map here is a map of Philadelphia broken down by zip codes. So we know that as of, and this data is as of September the 20th, so within a week or so ago, we had over 1 million doses delivered or administered to residents in the city of Philadelphia, with that being over 83% of that population receiving at least one dose was ages 18 years and older. We have 83.3%. Let me move this bar so I can see the rest of this graph here. Sorry. As far as the other residents, the 46,000, over 46,000 doses received among those 12 to 17 years of age, and fully vaccinated individuals, that would be all inclusive, all of those who are within the age range to receive COVID-19 vaccine in the city of Philadelphia. We have over 850,000 individuals who are fully vaccinated, which brings us to a total of 68.5% of the Philadelphia residents being fully vaccinated. The graphs here just shows a depiction of what these numbers are up here. The lighter area zip codes are areas where the vaccination rates are less than 4,500 per 10,000 residents. So these areas we're focusing on just to increase vaccine uptake in those areas. And that's pretty much it. Also, the rest of the graph shows a breakdown by race. This box here shows the bottom boxes here show African Americans, Asians, Hispanic, white, and other. And you can see the vaccination rates as of December up until September of this year. So that's September 1st, December 1st through September 1st of this year. Well, December of 2020, sorry. Go to the next slide, Pearl.
Yes. Yes, please. So let's talk about the Delta variant. It was first identified in India. The Delta variant is a lot more contagious than the original variant, which is the Alpha variant. The Delta variant spreads faster than the earlier forms of the virus that causes COVID-19. Unvaccinated people remain the greatest concern. Some data suggests the Delta variant might cause more severe illness than the previous variants in unvaccinated people. So unvaccinated people are at more risk with the Delta variant. Vaccines continue to reduce a person's risk of contracting the virus that causes COVID-19. So if you are vaccinated, your risk is reduced than the non-vaccinated person. Vaccines continue to be highly effective at preventing hospitalization, death, including against this variant. So people who have the vaccine are less likely to be hospitalized and to die from the Delta variant. Fully vaccinated people with breakthrough infections can spread the virus to others, but appear to spread the virus for a shorter time. So if you are vaccinated, you can still get the Delta variant, but it is a lot shorter and the illness is a lot less severe. So get vaccinated, wear your mask indoors and in public spaces to reduce the spread of this variant. Next slide, Mia. So there are 3 different types of vaccines that are available. The Janssen J&J vaccine, which is a viral vector vaccine. It's a 1 dose and it's authorized for 18 years and above. There's the Pfizer vaccine, which is the mRNA vaccine, and it's a 2 dose. It started as a 2 dose, 21 days apart. And this is the vaccine children can have because it's authorized for 12 years and over. At present, we are asking people, certain people in the population, to get the booster dose, and we will go into that later. The Moderna vaccine is also an mRNA vaccine, a 2-dose vaccine. It's 28 days apart, and this one is authorized for 18 years and over. Next slide. Sorry. Pfizer Fdr Approval. Excuse me. On August the 23rd, 2021, the FDA approved the Pfizer COVID-19 vaccine for individuals 16 years and older. The emergency use authorization still allows 12 to 15-year-olds to get vaccinated. The Pfizer vaccine will also be known as Comirnaty. I'm not sure I could say that properly, Mia.
Comirnaty.
Comirnaty. So that's the other name for the Pfizer vaccine. Mia, can you help me here? I'm having
Next slide.
trouble.
Can you hear me?
Yes. Can you take over from here?
Sure.
Thank you.
So let's see. So the Pfizer vaccine did gain full approval for 16 years and older. The brand name or the trade name for the vaccine, this is the Pfizer vaccine, is called Comirnaty. Go to the next slide. As Pearl said, or this slide outlines that the EUA or the emergency use authorization is still in effect for 12 years to 15-year-olds. So those age brackets, those falling under those age brackets can still receive the vaccine. So let's talk about what to expect after you receive a COVID-19 vaccine. So after getting a COVID-19 vaccine, you could experience some mild symptoms. They usually don't last for very long, maybe 1 to 2 days. Those symptoms include fever, injection or pain or sore arm at the injection site, a headache, muscle aches, tiredness or fatigue. These signs are a sign that your body is building protection against COVID-19. It takes 2 weeks after completing your vaccination series before your body develops full protection of from COVID-19. So we're going to talk about how the COVID-19 vaccines work. So the vaccines deliver a small code that teaches your body how to make antibodies to defend against COVID-19 virus. These antibodies protect you from getting COVID-19 in the future. None of the COVID-19 vaccines contain a live virus. So you cannot get COVID-19 from being vaccinated, and you can't test positive for COVID-19 because of a vaccine. So just FYI, the vaccine code breaks down and does not last long in your body at all, okay? We have a little picture of an injection. These here is just a pictorial of what your cells responding and creating antibodies, okay? These purple little Y-shaped things are your antibodies, okay? So Pearl talked about booster or additional doses. So CDC and FDA approved recommended doses or additional doses for certain individuals. So just to kind of outline who gets a 3rd dose versus a booster dose. So a 3rd dose is in reference to those who are considered severely, moderately, or severely immunocompromised. These individuals should get a 3rd dose of either the Pfizer or the Moderna vaccine 4 weeks after their 2nd dose in that primary series. So severely immunocompromised individuals. Right now, Pfizer is approved for that third dose and those additional doses. So in order to qualify for the third dose or fit the criteria, they are focusing on severely immunocompromised individuals. The time span between that, so after you're finished getting your second dose, the soonest you can get that third dose would be 4 weeks later, okay? But when we talk about booster doses for other individuals, there's individuals who should get it, but they have recommendations on those who may get the vaccine as well, the booster dose. So the booster dose is also recommended for individuals who are 65 years and older. Also, people who are 50 years and older with underlying medical conditions. People aged 18 years and older living in long-term care settings, okay? And the booster doses, this current recommendation is for those who received the Pfizer vaccine, all right? Other individuals who can get or who may get or may receive the booster dose are individuals 18 to 49 years of age with underlying medical conditions, people 18 to 64 years old at risk of exposure to COVID because of their jobs. And I have some things highlighted down here, like, so the jobs will be healthcare workers, firefighters, police, congregate care staff, teachers and support staff, including school administrators, child care workers, individuals working in food and agricultural, correctional workers or corrections workers. Those would be those who work in the prison systems, U.S. Postal Service workers, public transit workers, manufacturers, people who work for the Postal Service, public transit workers, grocery store workers, and individuals who live in homeless shelters. And that was a very comprehensive list, so we'll be sure to take questions later if you have further questions about booster doses, who should get them and who qualifies for a third dose versus a booster dose. Now, just to clarify, the booster dose is to be administered 6 months after your second dose of Pfizer vaccine. So let's talk about why it's important to get vaccinated. It's important to get vaccinated because we know that vaccines work very well. The vaccines can reduce the chance of getting COVID-19 and spreading the virus to others. COVID-19 vaccine can prevent you from developing severe symptoms and going to the hospital or possibly dying from COVID-19. Getting vaccinated can not only protect you, but also protect those around you. So since January, almost 99% of COVID-19 cases, hospitalizations due to COVID, and deaths due to COVID-19 were in people who were not fully vaccinated in the city of Philadelphia. This is the city data. So it's very important to get vaccinated to not only protect yourself, but protect those and your loved ones around you. So this section here, we get into some myths and facts about COVID-19 vaccines. Feel free to drop any questions you have in the chat.
Mia, there's one question. Do you want to answer it now? It's a quick one.
Let me open it up.
They want to know when children under 12
what age
will be able.
Under 12. So currently, if the question is asked about when children under 12, right now the CDC is still collecting data on that particular. Let me go back here. I skipped the slide, sorry. So currently there's no recommendation for those individuals younger than 12 years old because they are still doing research and collecting data and on that particular topic. So we're super I don't want to say excited, but we have a good outlook. We think it's possible, highly possible that recommendation will come through. But as of right now, we don't have any recommendations for the young children under 12 years old. So the 11-year-olds and younger, we don't have any recommendations for COVID-19 right now. But what I can say is those of you who are have questions about protecting your child who is 11 years and younger, I would encourage those that are around them, those that are taking care of this child, to be vaccinated, because that offers a layer of protection.
One more question, I'm sorry.
Okay, I'm trying to get back to my slide. Okay. I can't see the chat.
Okay, can I read it for you? I'll
Sure.
read it.
Sure.
They want to know, is the composition and dosage of the third or booster shot the same as the first and second shots?
Yes, it is. Yes, it is. The dose is the same.
That's great. And sorry to interrupt, Mia. I know you have to get through the rest of your slides. There was a question from a parent about flu shots and COVID shots for their eligible children and other adults. Should they get them at the same time, or should they space them apart?
Yes, thanks. That's a great question, because flu season is upon us, right? So yes, your loved ones can get both vaccines at the same time. I would recommend getting them in 2 different arms, but they can get both COVID-19 vaccine as well as the flu vaccine during the same day at the same office visit.
Awesome, thank you.
You're welcome.
Okay,
all right.
cool. Yeah.
I think I missed one of my, okay, so the first, let me see if I can go back. Let me see. Okay, so we were going to start talking about some myths and facts about COVID-19 vaccine. So the first myth that we used to hear a lot, especially during the beginning of, at the height of the pandemic when vaccine was made available, the myth is the vaccine was created too quickly. Fact, technology was already developed. So the technology for this vaccine has been in use for over a decade. So the technology was already developed. The technology allowed the vaccines to be produced easier and faster than other vaccines. Also, lots of funding was provided from the government due to the public health emergency. Manufacturing the vaccine started during the trials. Reviewing of the data from the trials was made the top priority. Companies still had to show that the vaccines were very safe. This is just a picture of one of the researchers who worked on the vaccine. Next myth, the COVID-19 vaccine will give me COVID-19. That's a myth. Fact, the vaccine will not give you any disease. The vaccine contains incomplete, inactive pieces of COVID-19 virus. Those pieces are used as tools to help your body build protection, the protection needed against COVID-19. So the COVID-19 vaccine will not cause you to test positive on any nasal swabs or any COVID-19 diagnostic tests. Next myth, the COVID-19 vaccine will alter my DNA. Fact, the COVID-19 vaccines can't change or interact with your DNA in any way. Both types of vaccines use a code to make a virus protein so that your body can make antibody protection against COVID-19, all right? This small piece of messenger RNA does not enter your nucleus, so it is not interfering or altering your DNA in any way. Myth, I already had COVID-19, so I don't need the vaccine. Fact, even if you had COVID-19, you should still get vaccinated. We do not know, or we don't know, how long someone's immune system protects them after getting the virus. Getting the vaccine will give your body additional training to fight COVID-19 virus. Although rare, it's possible to get sick with COVID-19 more than once. As we know, these variants are circulating and people can get infected more than once. However, getting vaccinated will also give you the best protection against this Delta variant. Myth, taking supplements will prevent COVID-19 infection. Fact, vitamins and mineral supplements cannot cure COVID-19. They cannot prevent COVID-19 as well. This was a nice Mythbuster from the World Health Organization. They have a great website. If you have questions, we have a link. I have a link that I can post in the chat once I close the screen, because I can't see the chat right now, to just give people a place, a reputable place to give you information about different myths and facts about different medications or different things that you can do to prevent COVID or to treat COVID. And these sites give great information. So the fact that taking supplements or the myth that taking supplements will prevent COVID-19 infection, that is a myth. Micronutrients such as vitamin D and C and zinc are critical for a well-functioning immune system and play a vital role in promoting health and nutritional well-being. All right, currently there is no guidance on the use of these micronutrient supplements as a treatment for COVID. All right, and WHO is the World Health Organization, is coordinating efforts to develop and evaluate medicines to treat COVID-19, but currently this is a myth. Another myth, if I eat garlic, it will prevent COVID-19 infection. That is a myth. Garlic is a healthy food that may have some antimicrobial properties. However, as with the other supplements, there is no evidence from the current outbreak that eating garlic has protected people from new coronaviruses. Okay, can eating garlic help prevent infection with the new coronavirus? The answer to that is no. That is a myth. Another myth, I'm young and healthy, so I'm not at risk for getting sick as older people. Fact, there is still a chance that you can get very sick or have symptoms for a very long time. Some young people have died from COVID-19. So this is just showing the number of cases. This axis here shows the age breakdown, all right? And as you can see, younger adults, we do have some cases here among younger adults and some deaths, okay? So for people to think, oh, I'm young and healthy, I'm not at risk, that is a myth. Everyone is at risk if you do not have immunity or have protection against COVID-19. Another myth, it is not safe to get COVID-19 vaccine if I'm pregnant or would like to get pregnant. Fact, there is no evidence that fertility problems are a side effect of any vaccine. There is no evidence that COVID-19 vaccination causes any problems with the developing placenta. COVID-19 infection is more dangerous for people who are pregnant than those who are not. So it is safest to get vaccinated before pregnancy. People became pregnant while in the clinical trials for this vaccine, and there has been no negative outcomes of pregnancy in those individuals who became pregnant after receiving the vaccine or during that clinical trial. So actually, there's actually science out there or studies that shown that it's actually beneficial to be vaccinated while you're pregnant because it gives protection to you and to your baby. So now we come to the point where making the decision to get vaccinated. When making a decision to get vaccinated, you have to just to consider the risk of severe illness and death from getting COVID-19. It far outweighs any benefits of natural immunity. You can talk to your healthcare provider, think about your exposure to COVID-19, like where you work or where you live. Consider your own medical history. Inform yourself and make the best decisions for yourself and the people around you. And that's it. You have questions, these are our resources. If you have questions about where can I get vaccinated in the city of Philadelphia, you can call 311 or log on to this website. It'll pull up a website that looks like this. It's a short survey, and you can enter your name and your email address. Or if you simply call 311, someone can get you connected to a vaccine clinic in your neighborhood. I think that's the end of my presentation.
That was awesome, Mia and Pearl. So extremely helpful. Thank you.
I'm glad that we could be of some help. I think I should stop sharing. So I can see everyone's faces. Hi.
Hi. Thank you. Thank you. And so
No,
for those who
no
may
new
have,
questions.
Oh, let me see.
yeah, and for those who are just joining, the Philadelphia Department of Public Health team, Pearl English and Mia Renwick, they are from the clinical team. And they just went through what is COVID-19, what do we know about the Delta variant, and some facts about the vaccines. And if you missed that part, don't worry, we are recording the Zoom, so we will post that later. Now we have the schools team. They are here to answer some questions about COVID-19 and student health and safety. So I'm really excited. We have Nina Lindenbaum and Diana Coleman. And so they're going to share their screen. And if you have questions related to student health and safety, you can also post them in the chat and we will flag that for the speakers. But thank you, Mia and Pearl. That was awesome.
Thank you.
So good evening, everyone. My name is Diana Coleman, and I'm going to begin the presentation on how in which we make sure that your children return back to in-person school during COVID-19 in a safe way. Next slide. So we'll start out with what do we know? We'll start out with what information do we know? So what we know is about 14% of all public school students have a disability. And according to the American Academy of Pediatrics, in-person learning is optimal for those students because of the additional benefits in-person school provides. As we know, when students are in school, they're receiving various services. They have a structured day. They're getting healthcare services, therapies, and also education. And in addition to that, they're getting other services. Next slide. Even though that information has been put out there, parents are still reluctant to send their children back to in-person learning because they know that their children are vulnerable. But what we do know is there are challenges that could increase risk to staff and students with this population of kids. And then also some may require additional supports when they're eating, when they're toiletrying, even with their schoolwork. So there's a more targeted approach to this population of kids. And so therefore they are at more risk, students as well as the staff. Next slide. Other things that we know is that changes to and the loss of structure and routine heavily impacts children with disabilities. We also know that in this space of change that requires a lot of flexibility, that a disruption of routine and a lack of understanding sometimes also has a negative impact on this group of children. And then additionally, school closures has even more of an impact on this group of youth because they then have to do remote learning, which requires internet access and assisted devices at times, and sometimes special curriculum. So there are challenges that are presented in the space of COVID as it relates to supporting youth with disabilities. Next slide. Now, what is it that we know that parents and guardians of children with disabilities are reporting in this space of COVID? So they're experiencing feelings of being overwhelmed and overburdened because they're having to have additional roles that schools previously would provide to their children. Also, it causes an additional level of stress for parents or guardians as it relates to kids that need additional supports in the school setting. that stress because parents are forced to adjust to a different type of interaction or engagement with their youth as it relates to school. And also the adjustment that the child has to make, that also creates a level of stress. And then of course, if the child is remote and learning at home, then that causes or exacerbates feelings of anxiety and depression. And it also can exacerbate pre-existing conditions. Next slide. So what do we also know? We also know that under all of those conditions, under all of those challenges, that there is no evidence of increased positivity rates at schools that support children with disabilities. So the same outcome that we have with in community rates are also the same outcomes or positivity rates that we're seeing in schools that support children with disabilities. We also know that attending in-person schools has not yielded increased positive tests either among this population of kids. Next slide.
So I'm going to take over here and go into some prevention things. Or Diana, was there something else you wanted to mention?
Not at all, go ahead.
Yeah, so I'm going to talk about prevention of COVID-19 within school settings and specifically with this group of children that we're talking about. So there are a few key practices that are kind of the baseline that we want to start with. And the first one, which is super vital, is universal and correct use of face masks. So not only is that wearing a mask at all times, except for when eating, it's also wearing it the proper way over your nose and your mouth. We also want to go over physical distancing where possible. And a little bit later in the presentation, we'll talk about more specifics about physical distancing within schools and how many feet is needed between students. Another really important one is hand cleaning. So hand washing while you're in school, doing that regularly, and respiratory etiquette, like sneezing into your elbow or coughing, things like that. Cleaning and maintaining healthy facilities. This is super important, is sanitizing the spaces before and after use. So if you have a place that, like a surface that is commonly used, maybe a lot of students will be touching the same table. We want to make sure that that gets sanitized regularly. And lastly, in the case that somebody does have symptoms or it does test positive, we want to do contact tracing and stay home when necessary. So stay in isolation if you test positive, or if you've been exposed to somebody, to stay in quarantine for the correct amount of time. We're going to dive a little bit deeper in for students with disabilities. Specifically, some of these precautions are we want to take extra precautions. We think they're super important. And that's because these students may have a higher risk of contracting the virus if they struggle with mask wearing. So maybe some people, it's hard to keep the mask on throughout the day. And also, I should say COVID-19 symptoms. So some symptoms like, a runny nose or a fever may be attributed to other things like allergies, sinus infections, or pre-existing conditions, and aren't thought of as a potential COVID-19 symptom. So for all of these, we want to say stay home when you're ill. If you have any kind of symptoms, it's a good moment to be extra cautious and stay home. Self-report mild symptoms. So notice when something new is coming up, when you have a runny nose or a sore throat, those are things we want to watch out for. And lastly, we want to be getting tested as frequently as possible. And we're recommending that schools have on-site testing to make this more possible. To go a little deeper into, what we mean when we say stay home if you have symptoms, we mean anybody, students or staff that are showing any of these symptoms should stay home until it resolves, just in case. So that would be if they have a fever, which is a temperature higher than 100.4, or chills, cough, shortness of breath or trouble breathing, fatigue, muscle or body aches or headache, sore throat, congestion or runny nose, any new loss of taste or smell, And then lastly, nausea, diarrhea, or vomiting. So again, if any one of these symptoms is showing up, this is a good time to stay home, reduce risk of exposing anyone else in school, and just try and recover and come on back when you're ready. Another thing, I said we'd go a little bit more in depth was about having students and staff wearing a face mask. So wearing a mask appropriately is very vital. And for some students who cannot mask correctly, such as students with severe autism, we have other options available. So there are face shields that don't touch your face specifically. There's a little bit of distance, and that also is a protective layer. If a student is struggling to wear a mask or a face shield, it's extra important that the staff, that the teachers, that the aides, whoever it might be, are wearing a face shield or goggles to protect their eyes. We also want to be, wiping our hands often and making sure that spaces have good ventilation. Now, there are going to be some times of the day that wearing masks or social distancing just isn't possible, and that would be during meal times when students are eating. And so at this time, it's very important that staff should wear face shields to just keep minimizing the risk of exposure during these times that we know are a little bit more risky. To go a little bit into why masking is beneficial, it's because it blocks respiratory droplets. So if you have any, any droplets, they won't reach others, and others' droplets won't reach you. It's like a barrier. And this is able to protect those around you if you are infected but not showing symptoms. What we're seeing is that often a lot of people are asymptomatic or aren't having any symptoms, and they're at a higher risk of spreading it because they don't realize that they're sick. So this is that's why masking is a really great precaution. It means that everybody is protecting everyone around them. So it's really, really important to wear masks, even if you don't feel sick at all. And here's a little chart on the side of how to wear it incorrectly. We've seen a lot of people might wear it below their nose. This is not really protecting anyone from your droplets. You want to make sure it's, even if there's air that can get in, that's not really right. We want it over the nose and mouth and snug on the face. Lastly, I'm going to go over social distancing in school. So we're currently recommending 3 feet between students, and that it's acceptable to be a little less than 3 feet if it's required for full attendance. This is just like the recommended, the gold standard that we'd like to see. We try and limit any large gatherings or big groups inside. If groups do need to come together, we really want that to be outdoors. And if it is absolutely necessary, students should be grouped by their classroom or cohort, just to minimize the interaction between lots of groups of students and keep them as separate as possible. We found that using assigned seating is really helpful with students to, have their spot and not mix around too much. And lastly, even during meal times, we still want to maintain that 3-foot distance between students. So I'm going to pass it back over to Diana to go over some mitigation strategies.
So let's talk about mitigation. Next slide. So we've talked about all the layers of protection. Now let's talk about in the event that there is an exposure and your child is exposed. So if your child is unvaccinated, then you want to remain at home for 10 days post-exposure. You want to also test between day 5 and day 7. And if negative, then you can return back to school on day 8. However, if a person is vaccinated, it's not required that they quarantine. However, we do want them to monitor for symptoms, and they should be tested. They should be tested between day 3 and day 5 after exposure, and they should wear a mask diligently until testing. Next slide. Now, Nina spoke briefly about contact tracing. So contact tracing is pretty much identified as identifying all those individuals that were within 3 to 6 feet. Now, the best practice is 6 feet. The recommended is 3 feet. But we use a rule of 9. where if we're looking at a tic-tac-toe board, and you can see it displayed on the screen here, that if your child is in the middle, then anyone in the north, south, east, west, and all the way around that's within 3 feet, those would be that person, your child's close contacts. And those individuals would need to quarantine. Anyone that shares an office space, anyone that's carpooling, because we know oftentimes youth are carpooling, and anyone that's eating in the same space. So anyone your child comes into contact with within 3 feet over a period of 15 minutes throughout the day, either masked or unmasked, those individuals will need to quarantine. Next slide. Now, what's quarantining and isolation? So isolation is the person that is positive for COVID. In that case, that person needs to stay in a separate room, even in your home. So they need to have a separate room. They need to use a separate bathroom. You need to avoid contact with any household member. You don't want to share any items, and you want to make sure you're cleaning things, utensils, cups, towels, in the event that you're not able to separate bathrooms, separate personal items that you're using. You want to make sure you're wiping those things down after use. Now, with quarantining, that means that the person stays at home for a period of time. And we'll talk about that period of time more in detail in the next slide. And while that person is in quarantine, they're monitoring themselves for symptoms the entire time, in the event that they then become a case, and then they have to isolate. Next slide. Now, speaking of quarantining, the way you quarantine is the day after exposure. In the space that we're in now with COVID, as long as a person tests negative between day 5 and day 7 after exposure, they can return back to school on day 8. Now, if that person opts not to test, then they will do the entire 10 days of quarantining in the home, and they can return back to school on day 11. Now, that entire incubation period, which is 14 days, they still want to monitor for symptoms the entire time. Whether they test positive whether they test negative or not, they still want to monitor for symptoms for the 14 days. Next slide. As far as isolation, the day after symptom onset or a positive test, you need to stay in isolation at home, away from everyone, using separate facilities, bathroom, utensils, if not, wiping things down. And after day 10, then they can return back to school on day 11. Next slide. I'm turning it back over to my colleague, Nina.
So I'm going to go over the guidance for pauses. And, this is kind of the worst case scenario, that maybe a school might have to pause for a few days to regroup if they have a few cases building up. And so we have built this guidance that says exactly what's going to happen in the school. So if you have 1 to 2 cases, these are 1 to 2 people testing positive within a school. The first step would be to quarantine their close contacts. So like Diana just went over, you'd look at the tic-tac-toe board, find out who they were sitting near, and ask those students to quarantine. If there are 3 cases, the whole class or the cohort would then be asked to quarantine. And then if that's within a larger group, back to the close contacts. If it's like a whole grade, it would just be the close contacts. When you reach 4 or more cases, the class and cohort would be asked to quarantine, and we'd also reach out to the PDPH, the Philadelphia Department of Public Health, and we would help determine next steps. And then when you get to 2 or more cohorts or 2 or more grades quarantining at the same time, or six cases in the same grade, if you have 3 or more grades in quarantine, or 3% of the school in quarantine, that's when it's going to come over to us, and we'll help make the decision of what happens next with the PDPH. Basically, the guidance is to try and keep as many students in school as possible that don't need to quarantine, and keep the students at home that do need to quarantine at home. But we found that there was just a lot of students out of school for a lot of days that, weren't actually exposed. So what happens here is once you have, a whole grade or a whole class in quarantine, as they start to build up, that then you reach out to the Department of Health for further guidance, and we would determine next steps. We also have just implemented a test to stay option. And so this means that anybody, I'm going to go through it slowly. So anybody who is not vaccinated and has no symptoms, if they've had close contact to somebody who tested positive, they can take a test as soon as possible after the exposure within 1 day. And then they should get tested every other day. So if they start getting tested on Monday, their next test would be on Wednesday, and then again on Friday, until they get to 7 days after the exposure. And, if that falls on a weekend, it would just be the next day in school. So this is saying if you were exposed to somebody, you can stay in school as long as you're constantly getting tested. And there's a few caveats to that. And one is that schools need to have rapid testing available on site to use this model. Students should be wearing masks, and any extracurricular activities or sports that don't use masks need to be paused. If a student for some reason is unable to wear a mask, they must complete the 10-day quarantine if they've been exposed. And families should be aware that there is an added risk here because you're continuing exposure after a known exposure. So after you've been around someone who tested positive, you're continuing to go to school, and that does pose an added risk. Any individual with a household exposure, this means if you have someone in your family or someone you live with who's tested positive, that's a household exposure. You would not be eligible to test to stay and remain in school. You have to do the 10-day quarantine. The last thing I'm going to go over is a few resources that we have. So you can text COVID PHL to 888-777 to have the most up-to-date guidance. And you can also check back at our website, which we can share with you. We do have a few sites that are offering pediatric testing for children. So, at this site, you can find a testing site near you. CHOP is doing COVID testing throughout the city, and also St. Christopher's. To find more information about vaccination opportunities, you can also go to the health department vaccine clinics, or there's vaccine clinics run by partners throughout the city as well. So that's a bit of the information we were able to go over today. I haven't been able to see the chat if there's any questions. So if anybody would like to read them out, we can go over, and that would be great too.
Sure thing. Thanks, Nina. And thank you, Diana. That was extremely helpful to have the visual graphics as well. And we truly appreciate your time. So I'm going to go through the chat. There were a lot of questions. So the first one is from an audience member. It's been a month since school started, but I still hear some parents' concerns about the school's sort of pandemic mitigation efforts. A parent reported that a lunch distributor, like a school food worker at the school, did not wear a mask while at work. Another parent said the teacher took off the mask during a lecture during school. And the teacher explained to the students that he had been vaccinated, so he didn't need to wear a mask. He also encouraged the students to take off their masks. So this parent wanted to know kind of who is monitoring how schools are implementing the layered mitigation strategies. Who's kind of checking to make sure that the adults are following the preventative measures?
I can answer this question.
All right.
So COVID schools, we monitor the activity of the schools and childcare centers to include the staff and their mitigations and the school's mitigation strategies that they utilize. So that's one thing. Ways in which we support the schools and childcare centers is that we do have regular meetings with them, check-ins with them, whether it be bi-monthly or as needed. And so that's an opportunity for us to provide the schools and the childcare centers with updated guidance. It's an opportunity for them to have question and answer sessions with us. And it's an opportunity for us to address things if things come across to us that if we notice a pattern of complaints that are coming through, that's an opportunity for us to do a thematic assessment of those complaints and then address those complaints or concerns in those meetings. So that's one way we support them. Another way we support them is your 8 parents, you are able to contact us through our email as well as our phone number in order to express complaints, at which time my team, which includes Nina, will contact that school. Your name will be anonymous, and we set up meetings with these Zoom meetings where we will not only address the concern that the parent or whoever it is submitted the complaint. We not only address that anonymously, of course, but we also use that as an opportunity to check in to see what mitigation strategies they are using. And then that gives us, and also we are able to identify or ask them what type of challenges they're seeing with individuals within their school, whether it's students or staff being in compliance with those mitigation strategies. And then that gives us an opportunity to problem solve with them. And then also that gives us an opportunity to talk to them about their health and safety plans. And in the event that they need support with their health and safety plans, we support them with creating or making their health and safety plans more robust. So that's another way we support them. And the last way that we support them as the community team is that we actually go into the schools, we'll do a walkthrough, see how they're doing with their mitigation strategies, and compliance with those mitigation strategies and health and safety plans. And we document what our observations are. And in addition to that, we sit down and do a survey that we've created to see how they're doing in those areas, to see if there's any room for us to work with them in a more targeted and intentional way. So there's many ways that we support not only the school, but also the parents. Next question.
That's extremely helpful. And I'm going through so there were about 3 comments from families saying understanding that it could be difficult for schools to implement. There are feelings that there should be temperature checks in the morning before students enter. And also, so they're questioning sort of why that isn't a part of the mitigation, so that way students who are already presenting with symptoms could just be identified before they enter the school and then expose people.
I could answer that question unless anyone else wants to. Although it wasn't in our presentation, because in our presentation, we speak of the layers of protection. Within every school's health and safety plan, monitoring for symptoms should be a part of their health and safety plan. So the hope is that prior to the child arriving to school, that the parent checks for symptoms, so that's the first level of checking for symptoms. But then as they arrive to school, prior to when they enter the building, there should also be a checkpoint where that child gets their temperature check also. And then there should be a questionnaire in regards to any symptoms that they may have presented prior to coming to school or even when they get to school. If that is not happening, contact us, because that's an opportunity for us to do some work and community engagement with that school to strengthen their practices.
That's right. And for those who may have missed it, Nina from the health department put the email address of this amazing COVID schools team. So that email address is COVID, COVID, .schools@phila.gov. So again, you can actually send an email if you have a concern, if you're observing folks not properly following the mitigation measures, you can reach out. And as Diana said, this team will be happy to reach out to that school and, not share any details about who made the complaint and kind of provide some technical assistance and support to that school team to see, the challenges in implementing the plan and how, what kind of training or support needs to happen. So I'm moving down the chat box. So if I haven't asked
one
your
more
question,
thing,
don't worry.
one more thing, Anna, in addition to that, if the school feels like it would be beneficial for us to actually come out and do a presentation face-to-face with not only their staff or even their parents, we're able to do that too, either virtually or in person. We also table at events. So we've been frequently going to back to school events. And also there's been plans for us to come to like report card conferences and things like that. So if you see that there's a need for parents and also staff to hear firsthand from the horse's mouth, then we're able to do that.
Fantastic. And there's I got a couple of comments. There are families who said that their teachers are actually having snack time inside the classroom. So that's like 30 something kids taking their masks off, eating snacks inside the classroom and not the larger cafeteria. And then the students are talking, they're breathing. And so, there's some concerns around how to make snack time safe. And a parent asks, like, shouldn't the teacher just remind students not to be like talking and socializing during snack time?
Definitely, it starts from the top. And so, yes, the top, when you're talking about the classroom setting, is the teacher. So to answer your question, yes, the teacher should be constantly reminding the youth. One, if able, they should be 3 feet apart at all times. Yeah. Two, as Nina spoke about earlier in the presentation, it would be great if they would have assigned seats, because that would minimize spread of anything. Mm-hmm. If they're in their assigned seats at all times in the classroom. 3, yes, they shouldn't be talking. And if they did all of those things, then your child should be safe in the classroom eating. Did you want to add more to that, Nina?
No, I think you got it.
Okay.
Fantastic. Okay, so question from a parent. Are the tests that are being done in schools saliva test or nasal swab?
I think that would depend on what the school is doing, but both forms of testing are accepted and are good enough for the school quarantine, for returning to school, anything like that.
And what we're seeing now being used more than not here in Philadelphia has been the nasal swab.
Pearl is on the line. She's a school nurse. Pearl, you do testing in schools, right?
I'm here.
Okay.
I'm here.
What type of testing do you use in your school?
It's the nasal swab, the Binax now, which is the antigen test.
Yes. And with that test, depending on your age, they can actually self-swab, and the nurse or whoever it is that is administering the test, they kind of walk the child through how to do a self-test.
Yeah.
Great. And so there's a couple of questions, logistics. A parent would like to know what happens when their school doesn't actually have a regular school nurse, like who's doing the testing or what kind of help can be provided to the school?
Yeah. Yeah. Well, the school district has partnered with CHOP to have regular testing. We do know there's There's opportunity for schools to connect to other entities to have testing come on site. The Department of Public Health, we assist with coming out and doing testing on site. And then also on the state level, there's programs that schools can connect to have regular testing within their schools as well. So there's various levels of support in the event that a school does not have a nurse. And oftentimes, even if the school has a nurse, those supports still are available because the nurse can't do it all.
Can I just add this, Diana?
Absolutely.
With the school, I could speak for the school district of Philadelphia because I am a school nurse in the school district of Philadelphia. So every region has a school that is there to do testing. So like when parents, let's say your child tested positive and you want the siblings to get tested between 5 to 7 days, there is a school that is allocated for every region where the parents can take the child.
Gotcha.
So in my region, in the Northwest region, there's Martin Luther King High School.
Gotcha. And, you know, there was a comment from a couple of families that did bring their kids to like massive testing sites, not necessarily yours, but they had said for their children with autism or other disabilities, they had to wait over an hour, maybe an hour and a half to get their testing done by at one of those school district sites. And the length of time that you have to wait is very difficult for some students with disabilities. And is there any way that those testing sites can provide some accommodations? That way those students can actually, make it to the testing part.
Absolutely. Yeah. That's a very good question. I think that one, if you know that you're taking your child to get tested, you may want to connect with the individuals that are at the site in advance to inform them that you're coming and when you're coming so that they can provide accommodations for you, because they will.
I agree. Good point, Diana. If they, especially if they work with the school nurse could call ahead and arrange, a specific time for them to come, like an appointment.
Mm-hmm. I think that's a great idea. And so just to recap for the families, if your school has a school nurse, let the school nurse know and they can reach out to the testing site to try to arrange, maybe a set time or other accommodations. A related question that a parent has asked is sort of, are the testing teams sort of trained on autism and other disabilities, and how do you do a test on a student that might have behavioral difficulties or may not be able to answer like verbally screening questions?
Can I answer that, Diana?
Absolutely, Ms. Pearl.
So my school, I do have 2 autistic classrooms, and there are some kids who would do it. They know I give them instructions. Some will follow instructions. And there are those who cannot follow instructions. And those are the ones I ask the parents to come in with them to help me get it done. And sometimes it's really hard. The parent has to do it. But sometimes the autistic kids would listen more to their parent than to a school nurse who they don't know.
I think another thing that is beneficial with the group of kids that we're speaking of is having pictures. Having pictures for the kids to look at, that may be interesting, that may, that may outline exactly what the instructions are, or how they're doing it, but in a picture type form. I think that would also be beneficial as well, or be helpful at least.
That's a great idea. Sort of like a visual schedule or something that outlines what to expect.
Absolutely.
Yeah, and if you need help creating that, our group can help you with that. And I'm just scrolling through the chat to check other questions.
You know what? One more thing. Just thinking about individuals with disabilities. Also, perhaps creating a private space for that person to be tested. You know, oftentimes, you know, the kids, they come in and get tested, and sometimes they're scared. And there's a lot of people around. And so, as we know, since we're speaking of children with autism, sometimes they have sensory overload or, you know, sensory concerns. And so maybe they don't need to be in a space with a lot of people, with a lot of noises. So we want to kind of minimize all those distractions, all those sensory things.
That's great. Thank you, Diana.
If I can add to that as well.
Yeah.
Earlier, I'm sorry, earlier in the, you know, at the height of the pandemic, when testing was just as, you know, just as or more so important, it's always important. But, you know, when these, we know that COVID is a new thing for us and we're learning. Sometimes we say we're building the plane while we're flying it, right? So there were a lot of, you know, different scenarios and nuances that come along with testing. And the most important thing was just making sure that everyone had access, especially those with physical or intellectual disabilities. CHOP was one of the premier people who opened up and said, hey, you know, we're willing to, you know, we can accommodate children with autism and test them in an environment that's conducive to them and comfortable. So just to have that on your radar, you can reach out to the different CHOP sites in your area, or if you're affiliated or you know, have any pediatricians who are affiliated with CHOP, definitely reach out to them because they have a wide network of you know, these opportunities and these resources for individuals with intellectual and physical disabilities, especially for children.
Yeah. And, you know, so some of our families live in multi-generational households. So maybe it's like a grandparent, the parents, the kids. And there was a question, are students the only ones who can get tested at the school sites? Or if they've been informed that your child has been, you know, exposed to someone at school as a close contact, can the whole family get tested at the school testing site, the school district run testing site?
It really depends on the provider. And I'll let Pearl elaborate once I'm done, but it really depends on the vaccine provider. I mean, the testing provider, I'm sorry. Because we've been in situations where we've done testing where we're only focused on the children that attend the school. But then we've also been in testing situations where family members and even community members have been able to come and get tested as well. So I've seen both. Pearl, you want to elaborate?
I could, you know, elaborate on the school district testing sites. It is very full right now, and I know that they are only doing students and staff. This is the second group that I heard this complaint from, that they had to stand in long lines. And right now the district is working on doing that. Instead of having the school nurses do the testing, they are working on trying to vet an agency. So it would be a totally different, you know, organization doing the testing for the children and staff.
Yeah. Can I put a plug in for PDPH? If there's a whole family unit that wants to get tested at the same time across the city, you can find a Philadelphia Department of Public Health clinic. They will test you all right there, right on the spot, free of charge. You get your results in what, 15, 20 minutes? And you know, so that's a resource. And we could drop that link in the chat, or I believe it's on our slides at the back when it says testing and vaccine.
Yeah, Betty has been dropping the links as we've been presenting.
Thank you, Betty.
So great.
And also I know that there's testing kits that you can purchase on your own in the stores. That's also acceptable as well.
Yeah, there was some miscommunication with a school principal that said I can't accept third party or home tests. I need
Okay.
to get it from an official site. But it's helpful to know that if
Yeah.
the parent has, has the test, and can like maybe text the results or email a picture, that would
Right.
be acceptable as well.
Absolutely, it's acceptable. So if any parents have concerns with that, if they do use a home test and a school is not allowing their child to come back with a negative test, get in contact with us and we'll
Perfect.
follow up to support you.
Perfect. And so some of these families that want to make sure that they're not sending their kids into school, one of the parents had shared that it is kind of difficult because not all families have access to like a thermometer, and thermometers cost all different prices. So that was just sort of reported as one of the reasons why they would really encourage, like maybe at the school, for them to have like one device that's doing like a temperature scan. Um, a second comment was around sort of families' abilities to isolate or quarantine. A comment was just that, when you're living in a multi-generational household, there's not a lot of space or extra room. So, I know during when COVID first happened, the city had COVID hotels or things like that. Are
Yes.
there resources like that? Like if there are multiple family members that need to be quarantined or someone has a health condition and the infected person ideally should not be near them?
Right. We do still have resources to support INQ. Unfortunately, it is a resource and we don't know the extent or how long that will be available. But if you ask us right now, today, yes, it's available. It's available right now. But like I said, I don't know how long that's going to be. But for those multi-generational or just households, big households, it could just be me and my husband and I might have 5 kids, and, if I get sick, I need to isolate, away from my family. And that is an option. So reach out to PDPH. And especially if you participate in our contact tracing efforts, if you're a positive case and you go through the whole process with us, would definitely make sure that you get the resources that you need if available.
And in addition to the isolation and quarantining, quarantine sites, there's also programming, as Mia alluded to. If you're a part of the contact tracing program, there may be also resources that can be brought to your home. So there doesn't have to be a lot of crossing within the home. And also, even within the home, if you notice that you're not able to have your own individual space, you may want to create hot zones and cold zones. And so those cold zones need to only have individuals in that room that are, that are negative. That hot zone could be just the individual that is positive, and they need to make sure they don't cross. In addition to that, if they can't do that and they do have to cross, then in the home, you want to make sure you're masking when you're around that person. And also that you're wiping down things. When you leave out, when the person that's positive leaves out or not, you want to wipe things out. Or when the person that is negative is entering a room because maybe they have to support the person that is positive, that they wipe things down and that they have mask on throughout the entire, throughout that entire interaction.
Right. And PDPH does support those efforts as well. So if there's a need for a mask, if there's a need for thermometers, you reach out, especially if you're a part of the contact tracing efforts here in the city.
Right. So if someone calls you and wants to do contact tracing, pick up the phone.
Yeah.
Don't hang up or don't not answer because you don't recognize the number. Or if you hear the voicemail, call back, because not only are they trying to reduce spread by helping you all with quarantine and isolating within your homes, but they're also trying to provide some resources for you also, so you can do it safely.
Yep.
And comfortably.
And comfortably.
I will be checking my voicemails more carefully now. After all those car warranty messages, I have to be honest. Now, I do see Betty has her hand up and she has dropped several helpful links. So Betty, would you like to speak?
Yes, I actually just found and dropped the link for isolation and quarantine. It's an article that's translated in simplified Chinese. I also included the hours of operation for the phone number that you can call to ask about isolation and quarantine.
That's awesome. And if you're joining by phone and you can't see the chat, the phone number to call to ask about the sort of quarantine or isolation, free space is 267-396-2712. That number is 267-396-2712. Again, this is a free service. And, again, we just are so grateful to the Philadelphia Department of Public Health, COVID containment team, the schools and clinical team, Mia Renwick, Pearl English, Diana Coleman, Nina Lindenbaum, and Betty. How do you pronounce your last name?
Mulugeta. Thanks for asking.
And Betty is the outreach specialist who pulled all of this together, all the different teammates. Huge thanks to our wonderful interpreter, Selena Chen. She's amazing. And so I really want to thank all of you for your time tonight. It is now 7 p.m. You've hung in there for a long and detailed presentation, but I have to say this was extremely informative. And I really want to thank the Department of Public Health. Let's give them a round of applause. Thank you so much for a fabulous job. If you missed part of the session, I'll have the recordings in English and in Mandarin to share back with everyone. Thank you so much and have a wonderful evening. Thanks again to the Department of Public Health. Great job.
Thanks for having us, Anna. You have a wonderful evening.
Yes, thanks for having us. And we're here to support you all. And together we're stronger. So let's do this together.
Oh, you're awesome. Thank you.
Thanks, Diana.
Thank you.
Yeah, have a good night.
Have a good night.